Washington.
Thank you so much, Mr. Chairman. Recently, 2 of the largest health clinics serving my district were bought by United Health Group, a prime example of consolidation of our healthcare system. United Health then demanded a significant increase in payments from another health insurer during tense negotiations in a highly consolidated health market. As a result, over 19,000 of my constituents were notified that they would likely lose access to their doctor. As hospital consolidation in situations like this are becoming more common nationwide, it's just important that we take a look at the impacts of hospital consolidation on people's health and medical costs. Seattle isn't alone in experiencing these hospital mergers, and we've seen a concerning increase of mergers across the country. A recent report by the New York Times found that areas with the highest rate of hospital consolidation had prices go up between 11 and 54%. So, Ms. Tripoli, can you describe what typically happens when there is a high rate of hospital mergers in a region?
Absolutely. It really comes down to when you see increased concentration in a market, it gives greater negotiating power over being able to set prices, essentially. So what we've seen in the hospital business model is a complete shift, and it's based on 2 things. Buying up local competition so you can gain more negotiating leverage over how to demand higher prices, and generating high volumes of high-priced services. And the result, of course, the prices get passed on, particularly in the commercial market, to employers. We see stagnant wages, we see increased premiums and cost sharing for consumers, and we're stuck with unaffordable healthcare care, rising levels of medical debt.
One of the things that we hear from the hospital industry, they often claim that hospital mergers increase the quality of care. Is that true?
I think what the data shows us is that typically is a claim, but the data shows us that quality either stays the same or in many cases gets worse.
So it's really not true at all. Hospitals also claim that mergers lead to lower healthcare costs. Is that true?
That is definitely not true.
Definitely not true. Ms. Monahan, these hospital practices often lead to people losing access to their medical providers. What do experts say about the impact of losing access to your care provider and then having to find new providers, new specialists?
I think it's a huge problem for consumers, and one thing that we see, for example, it's kind of this intersection of hospitals merging and acquiring physician practices and then how the insurers have to respond. And so one example is that, insurers are trying to lower costs, and so they will say, if you go to an independent practice, it will cost you less than if you go to this now hospital-owned location. And that puts the consumers in a really tight spot because they may want to prefer to continue to see the doctor they've been seeing. Maybe they're in the middle of a course of chemo, and they now have to pay maybe, several $100s more for every time that they go in because the hospital owns this practice now and is charging a lot more for them.
So it really reduces freedom of choice to see the doctors and specialists that you want. Representative Sparks and I have championed bipartisan efforts to expand antitrust enforcement to nonprofit hospitals through our legislation, the Stop Anti-Competitive Healthcare Act. Ms. Tripoli, can you tell me a bit about how increased antitrust enforcement would affect competition in the healthcare system?
Yes, and thank you for your legislation. It's very exciting to see. As I understand it, the FTC currently does not have the ability to intervene and investigate mergers and acquisitions among nonprofit hospitals in particular. And as far as consolidation, we're seeing increased consolidation across all types of hospitals, nonprofit, for-profit. So giving FTC the authority to actually be able to investigate would go a long way in helping us to address the parts of the markets that are still not consolidated.
I really appreciate that, and I invite all of my colleagues on both sides of the aisle to join our bipartisan legislation. Hardworking Americans are bearing the brunt of increased healthcare costs from hospital consolidation, and I think it's really important that we work to prohibit these anti-competitive practices in healthcare and also go further, in my view, and enact a universal single-payer healthcare system that would remove insurance middlemen who often perpetuate anti-competitiveness. I have that bill, of course, the Medicare for All bill. The only competition in healthcare should be providers competing to provide the best possible care for their patients. That should be the only objective, the only goal. I thank you all for your work, and I yield back, Mr. Chairman.